Mr. President.
Senator from Illinois.
Mr. President, America has never seen anything like this before. To think that half of the people who live in the United States are under some order to either stay home or at least avoid contact with others, unheard of. This is an enemy, this virus, the likes of which we've never faced. As strong and determined as our nation is when it comes to these challenges, this is unique. And it calls for unique leadership. There are a lot of critics of the United States Congress for good reason. But I think what we've demonstrated in the last several weeks since we've addressed this coronavirus is that there is a capacity for common sense, bipartisan work, and a timeliness that is essential. The first two measures were passed in record time, one for $8 billion that really opened the door for more medical resources. The second for $100 billion, which tried to guarantee to people they would never have to pay to be tested for coronavirus, that there'd be adequate food supplies during this calamitous time, that we would have resources sent to the states for Medicaid reimbursement at new levels, that we would also engage people with family leave if necessary so that they could stay out of the workplace if they felt badly, and that we'd also have an idea that we would come together as a nation to move unemployment insurance with dispatch. That passed, again, in a timely way with a bipartisan vote. And then we came to the third challenge, a challenge the likes of which I've never seen in my time in Congress, and I don't imagine anyone else has. Because we decided in a span of about 7 days to come up with a package of authorizations and appropriations which is larger than the annual federal budget for domestic discretionary spending in America. In 7 days, we did what usually takes 12 months or longer, but we knew we had to because the need is that great, and America was watching and wondering if we could rise to that challenge. There were some bumps in the road, and it's no surprise. An undertaking of that magnitude with this kind of pressure to get the job done quickly and properly is bound to create differences of opinion, and it did. There were moments of anxiety on the floor of the Senate, and those who have followed C-SPAN have watched many speeches that reflected the emotional levels that were reached in this chamber. But the emotions in this chamber were not that different than the emotions in most homes across America as people worry about whether this illness will touch their families, and if so, will they be able to conquer it? That emotion on the Senate floor led us to further negotiations and an effort to try to make a bill presented to us on Sunday better 3 days later. And that brings us to this moment. History will judge, as the senator from Kentucky noted earlier, as to whether there's an improvement that's been made to this bill over the last 72 hours. I'll just stand up and tell you I would testify definitely. Definitely. Because just consider the first priority. We have to make sure that hospitals and clinics and healthcare providers at every level in America are prepared to rise to this challenge, and we know this is a challenge the likes of which we've never seen. When the governor of New York suggests that the hospitals of that great state expand their capacity by 50% as quickly as possible to take the incoming patients from this COVID-19 virus, and be prepared, he said, to expand it by 100%, we appreciate the magnitude of the challenge. On the Democratic side, our leader, Senator Schumer, has called it a Marshall Plan for hospitals and healthcare. I don't think that's an exaggeration. The bill that was presented to us on Sunday envisioned some $75 billion for that purpose, and many of us felt that was not adequate, as large as that number may be. So today we'll bring a bill to the floor that will increase that allocation for healthcare from the $75 billion in the bill just 3 days ago to $130 billion. Is it enough? Probably not. unless God spares us from the spread of this disease even further in the United States. But it says to those who are anxiously expanding their resources, expanding the number of beds, bringing in retired medical personnel, as the governor from Illinois, J.B. Pritzker, is doing, that we hear them and we're providing them the resources to go to work to fight this challenge that we face at every corner of the United States. The second thing that we set out to do when the bill was presented on Sunday was to expand the opportunity for unemployment insurance. Some have criticized us on the floor and said, don't get into structural changes. Well, you couldn't expand unemployment insurance without getting into a structural change, because the system, which affects only a small percentage of Americans, is not adequate in most cases to keep a family together. If you lose your job and try to live on that unemployment check, it's hard to do. People lose their homes over that, their cars. They can't pay their utility bills. And so what we've done, it's been described as putting unemployment benefits on steroids. The amount of money which is going to be sent to families who are furloughed, laid off, or unemployed is dramatically bigger than it would have been if we hadn't restructured unemployment compensation. At the same time, the President and the White House suggested direct cash payments. We never argued against those, but said it's just a down payment. It's just a single check. We believe unemployment insurance is going to be a guarantee of payments for months to come. Since Sunday, we expanded the period of additional unemployment compensation from 3 months to 4 months. There's a big price on that, of course, but we think it's reasonable to give people peace of mind that for 4 months they'll be able to keep their families together as we work our way through these medical challenges and, God willing, see our economy back on its feet. I hope that happens. I hope it's even sooner, but we're prepared for 4 months. The third thing we set out to do is one that's near and dear to me in my state, and I'll bet in most other states. We set out to compensate the states and some localities, counties, and cities which are expending substantial sums of money because of COVID-19 threats that they are facing. Let's face it, for the most part, our governors have been in the front line of defense when it comes to America's health care over the last several weeks. They've done exceptional things, and they've been called on to spend money in ways they never dreamed that they would be called on to spend. For example, unemployment benefits, which involves state payments in many respects, have mushroomed and skyrocketed, sometimes 10 times the number that they were just last year at the same time. My governor, others, mayors, and the leaders of county government have come forward and said, are you going to help us? We're spending a lot of money because of this COVID-19. Well, this bill does it. It was not an easy task. We had to convince the other side that it was money well spent. And I'm happy to report that on a bipartisan basis, we reached that agreement. Some $150 million will be going to these state and local governments, as it should. Those are things that I believe will move us down the path toward resolving this challenge in America and doing it the proper way, always keeping in mind that the welfare of workers and their families is the paramount concern. First, the investment in the medical side to stop the onslaught. Second, the support for families and workers across America. There were some items that are still being debated on the floor here. You've heard it in the early statements by the majority leader, and those relate to the benefits to be given to businesses to keep them moving forward. We all understand the aviation industry is at the heart of the American economy. It is an engine in one respect to move it and a reflection of its activity in another respect. And that aviation industry is flat on its back. Some 80 to 90% of the passenger load has disappeared. Hundreds of thousands of employees in the airline industry have come to us and asked for help. And we're prepared to do that. And that is part of the package that will come before us. The administration also asked for resources to be loaned to other businesses that need a helping hand. I'm not opposed to that. Some are, but I'm not. But I do believe accountability and transparency are essential. Since Sunday, we have dramatically changed this package so that there will be transparency and accountability on a timely basis as decisions are made by this administration to allocate these taxpayer funds to help these companies. Some of us learned a bitter lesson in the past when benefits were given to corporations and they were misused for stock buybacks and dividends and profiteering at a time of great national need. We don't want to repeat that story. We want to make certain that taxpayers' dollars invested in these corporations are really designed to get them back on their feet and the economy moving forward for the benefit of everyone who lives in this country. So that accountability and transparency are essential. And I believe this new agreement, some 3 days after the original one was proposed, is an improvement. Credit should be given to both sides for many of the things that I just mentioned, because Democrats and Republicans had to agree for this to make the final package. But we believe what we'll vote on this afternoon, and I believe we'll enjoy strong bipartisan support on the floor of the Senate, is a dramatic improvement in the last 72 hours. Credit to both sides. We believe some of these ideas were essential, and that's why we voted as we did on the floor. But to reach this agreement and bring it forward, it took both sides. I want to salute my colleagues, starting with, of course, the Democratic leader, Senator Schumer. He's put in some hours. I can't tell you how many times I've stepped into his office and Michelle, his assistant, has told me he's in with Secretary Mnuchin. They spent days together, going till midnight and starting fresh early in the morning, trying to reach an agreement, which I believe we've finally done. Finally. There are just a few little items left, but I don't think they'll hold us up. So to Senator Schumer, his staff, and to all my colleagues, ranking members, who pitched in their committees of jurisdiction to try to come up with good ideas and to sell them in a bipartisan agreement, there was an exceptional amount of work. Special credit, too, to the staff, my own and the others who've come to work in this dangerous moment. We're being told to stay home, telework from home where you have to or where you can. In some cases, you can't. And those who did show up in the Capitol, including the staff that's here today on the floor, come at risk. We know that. Risk to their own health and the health of their family members and others that they love as we do. So I thank them for this. I understand that we may be gone for several weeks, and I think that is appropriate, but for a national emergency which calls us back, and we will come back if that's necessary, I think we should take some time away from one another, away from the Capitol, to really mind to our own health and the well-being of our own families, and to work back home as best we can, teleconferencing in other ways, to let people know what we've done with this new legislation. I hope that during this period of time that I can engage my colleagues in thinking about another issue. Senator Portman, Republican of Ohio, and I have introduced legislation calling for at least an inquiry at this moment in history about remote voting or some different approach to voting that doesn't require our physical presence on the floor in times of national emergency. It just makes sense. The fact of the matter is, our meetings of the Senate almost every single day have violated CDC guidelines that tell us not to gather in a group of 10 or more. And yet we come to the floor because we have to, because this is life or death when it comes to this legislation that we're considering, and we know what our jobs are. We can find a better way to do this in the 21st century, using the technology that is available in so many different ways to have verifiable, accurate, honest voting for those who cannot or should not physically be present on the floor. I've spoken to Elizabeth McDonough, the parliamentarian of the Senate, and her staff, and want to engage in a conversation. What we know is that this is historic, and it really is a dramatic change from what we've done in the past. But I don't think it's unrealistic. I think it reflects the reality of where we are today with a public health crisis. It may reflect the reality of tomorrow, which could be some different national emergency or, God forbid, some terrorist activity that keeps us away from this Capitol building when we still have work to do. So I want to thank Senator Portman, Senator Klobuchar, who has really been one of the leaders in this effort, Senator Schatz, who I know is a co-sponsor. We are now up to close to 20 co-sponsors on a bipartisan basis to move forward in this change in the Senate rules. I hope we can have conference calls during the time that we're physically away from the Capitol and move this idea forward. The House is considering the same thing as well. Now is the time to do it. It's time to bring this great body, the United States Senate, into the 21st century when it comes to executing our constitutional responsibility without endangering anyone, especially members and their staff and family. Mr. President, I yield the floor.